management of hand fracture seems to cause so much consternation and confusion among trainees, and indeed among some consultants as well. But before we decide on what sort of fracture fixation is required for a fracture of a hand bone, we need to first decide if the fracture needs surgery at all. Hi, I'm Sanjay Majumdar and I'm a hand surgery consultant in the UK. In this video, I shall outline the algorithm which has served me well for over 25 years. This very simple and elegant algorithm was developed by my hand surgery consultant colleague Stephen Southern. So let's get going then. Now the algorithm relies upon two questions. The first question is the fracture in an acceptable position? By acceptable position, we mean that were the fracture to be left in that position, it would heal and not negatively impact on hand function. Now, examples of unacceptable positions: a fracture where the bony ends are not in contact, so may not heal, and where a fracture has caused a rotational deformity of a digit, resulting in scissoring perhaps, where the fracture might heal, but the hand function may be adversely affected. Now, the answer to the "is it in an acceptable position" question could be yes, it could be no, and of course, it could be we're not sure. Now, if the answer is yes, then we progress to the second question in the algorithm, which we shall discuss shortly. If the answer is no, then the patient needs to have the fracture reduced, which means the bones need to be aligned into an acceptable position. Once the bones have been set into an acceptable position, we go on to the second question. Of course, the answer to the question could be that we are not sure. In this case, further imaging, such as CT or even a 3D CT, may be required to help us make that decision. Now, once further imaging is obtained, we go back to asking the question as to whether the fracture is in an acceptable position, and hopefully we should have enough information to decide whether it's a yes or a no. Now, once the fracture is in an acceptable position, we have to ask the second question, which is the fracture stable? And what the stability question is trying to answer is, if the hand undergoes supervised mobilization, will the fracture continue to remain in an acceptable position, in which case the fracture is deemed stable, or will mobilization of the hand cause the fracture to slip into an unacceptable position, in which case the fracture is deemed unstable? Now, we know that certain fracture configurations, such as impacted fractures, are more likely to be stable, while others, such as spiral and oblique fractures, are more likely to be unstable. However, the decision regarding stability should be made taking into consideration not only the radiological finding, but also information from the history, such as the mechanism of the injury and the examination findings as well. Now, again, we have three possible answers to the question: yes, no, or unsure. If the answer is yes, the patient goes straight to hand therapy for supervised mobilization, possibly with the judicious use of splintage as necessary. Now, if the answer is no, then the fracture needs to be stabilized. There are several ways to stabilize a hand fracture, from non-invasive techniques such as the use of splints to surgical procedures using K-wires, plates and screws, etc. But whichever method of stabilization is employed, the patient must then have mobilization of the hand under hand therapy supervision. This is because if an injured hand is immobilized until the fracture heals, the risk of a stiff hand or digit is very high and can be catastrophic for the function of the hand. So it is important to remember that stabilization must allow for mobilization. Now, if it is the case that we are not sure if the fracture is stable, further imaging, including dynamic imaging using a C-arm, may be helpful. If further imaging is still inconclusive, a not unreasonable approach may be to commence supervised mobilization, but monitor closely over the next few weeks using repeated and regular assessments, both clinical and radiological, to ascertain whether the fracture remains in an acceptable position and whether it remains stable, and use the algorithm if necessary to determine further management for the patient. So to re-emphasize, the fracture needs to be in an acceptable position and be stable enough to allow mobilization. The desired end result of the management of a hand fracture is good function. A healed fracture alone is not enough. The injured digit and hand needs to have optimal movement and not be stiff. I hope this helps. Happy fracture management.